Morning, everyone. I'm Tom Goddard, Director of Services at Mining Croydon. I've got about 10 minutes I'm going to give you an overview of what Mining Croydon is and the projects that we deliver that might be of use to the people that you work with and support. And at the end, there'll be an opportunity to ask any questions or clarify any points you might have as we go. Sorry, my mouse has decided to stop working. Right, here we go. Okay, so Mind Croydon is part of the Mind Federation, the national organisation Mind. We work just in the borough of Croydon and to an extent in the surrounding area, but predominantly in the borough of Croydon. We've been around since 1967 as an independent charity. We are located, our head office is currently in Purley, and we have an office in South Croydon. We co-deliver from site in the Whitgift Centre, and we have another site at East Croydon in a building called Fairfield House. Up until the last couple of years, we did also have some charity shops in the borough, but that's we're no longer running those. And just for the sake of completeness, there's 101 local mines across the country, each with their own geographical patch of service delivery. Our neighbours, for example, South East London Mine, that covers 5 boroughs in London, but we're a single borough mine. And in the scope of mines, we're around in the size we're in the middle really on the size of the operation. Last year we 15,000 people came through our services. That's 15,000 unique individuals across the projects. So here's a brief overview of our projects, and I'm going to go through those one by one very briefly. Someone please tell me if I do start overrunning. I won't be offended because there's a fair bit to cover. So predominantly our work is through service delivery, so supporting people through giving them practical and emotional support. But another element of our work is also campaigning, and we predominantly do that through through our membership of Mind and their policy and campaigns team, because they have real reach at collecting information from each of the local mines and providing those voices at government level and helping to shape policy. So yeah, I'm going to go through the projects now. The first one, Active Minds. This is funded by the City Bridge Trust and also from Croydon Talking Therapies and a little bit from the Integrated Care Board as well. Active Minds is a long-standing project. You can be self-referred in there, or you can be referred by a professional. But essentially, it's a project that is online and face-to-face, and it's delivering sporting, relaxation, physical activities to people of all abilities. So there's a real range of access to this project, and it's incredibly popular. We're operating it on effectively on a shoestring quite often. But yeah, it's free to access for people who are looking to undertake physical activity in a supported environment for mental health. Because we know the links between good physical health and mental health, and also that taking those often small steps, people might not be used to coming out of the house, but then come into these activities and then forming a routine can be real beneficial to people. The next project, ARCC. So predominantly the service is based in the Royal Bethlehem Hospital. It's a statutory service funded by the London Borough of Croydon. Predominantly working with people who fall into scope for independent mental health advocate people who are under the in hospital under section of the Mental Health Act. And we have 3 advocates who support people while in hospital under the Act to express their views, their feelings, what they would like to happen next. And that happens within the confines of the advocates undertake a qualification to become an independent mental health advocate. The project, that's the main backbone of the project, being when people fall under that category. But there's also an element of what's called community advocacy, where which isn't statutory, and they're able to provide that same level of expressing thoughts, what we'd like to happen next, but in the community, and also for people in hospital who are no longer under the Mental Health Act or haven't been under the Mental Health Act. Carer support. This service again is funded by the London Borough of Croydon, and it's in the last year it's pivoted to be for supporting people of over the age of 24 years old, and it's for people who are either a carer who's experiencing mental health difficulties, or someone who's caring for someone who's experiences poor mental health. And it's quite a lot of the element of the project is bringing carers together for mutual support, for respite, for understanding their rights, benefit maximization. But yeah, as I said, the real core element is that having someone to talk to, because and having your peers that have been through the same thing and the challenges of being a carer. It's self-referral. Contact details are on there, how to access. Predominantly the groups come together at East Croydon. There's elements at the weekend, there's elements in the evening, and it's increasingly popular service. The Croydon Health and Wellbeing Space, that's in the Whitgift Centre, and we delivered that in partnership with the Croydon BME Forum and also with SLAM. The project started, sort of the delayed start around 2020 into 2021 in that pandemic time. It's a the branding Croydon Health and Wellbeing Space came together through lots of lived experience feedback of what people wanted to see, and it was a service that they could walk in to get support that didn't necessarily scream, this is a mental health service. And so it was designed with the NHS, with the BME Forum, and with ourselves, and then most importantly with people who might want to use the service, of what it looks and feels like. It's incredibly busy. It's there's a degree of open access, but to try and manage that, we're now doing booked appointments. But it's effectively one of the first sort of routes in for a lot of people for getting support, so they could come with a wide range of inquiries around housing, benefits, their mental health. There's also the clinical psychology team from the NHS at the location, so you could be getting support around your housing, but then also getting that NHS support under one roof. It's Monday to Saturday, and it's, as I said, it's incredibly busy. I would say if someone wants to access it, the best first route in is to probably phone first to see if your inquiry is going to be something that's going to be able to be supported when you get there, and when might be a good time to go. Mental health picks, so mental health personal independence coordinators. This again is in partnership with the Croydon BME Forum, so it's a shared team. Half the employees are Minding Croydon, half of the Croydon BME Forum. It's a service that sort of looks at setting goals with people. It's the people are picked up or referred into the service generally through their GP or GP huddles, and it's for looking at people experiencing poor mental health and physical health around overcoming barriers to challenges. So it might be setting a goal of, I'm going to go to this bus stop, or I'm going to go and join the library, and someone supporting them to do that. The service is able to do home visits, because quite often people that getting out the house is like one of the first challenges that they work on. And yeah, that unfortunately does have a waiting list at the moment, but
Do you want to have this on the background? It's background radio, yeah.
Okay. The next service, I'm not sure how I'm doing for time, but the next service, peer support in reach. This is funded by the South London Partnership, which is effectively NHS funded, and it's for peer support, people who are currently on rehabilitation wards in hospital. And we currently work across 6 sites across South London. In Croydon, that's at the Bethlem Hospital. We do the service delivery in partnership with 2 other local mines, and predominantly the staff in the service are people who have had experience of being a mental health inpatient themselves. And again, it's about setting goals, developing plans for when someone comes out of hospital, like, where's my local bus stop? How am I going to get to the supermarket? What's it going to look like having a pile of letters when I arrive home? Do I have a home to go to? And sort of helping with that discharge experience through someone who's been there and done that themselves. And it's quite often been someone's first paid role after being in, having had maybe a long time in hospital. And it's sort of the aims of the project is to support that discharge process through having someone to talk to who's been there and done it. The recovery space. So this is our crisis service. It's 365 days a year, 7 days a week, from the morning up until 11 o'clock at night. Based out the Whitgift Centre in the Croydon Health and Wellbeing space, but also at East Croydon, and also online, and also outreach. The referral process is there's a few caveats, but predominantly it's professional referral, and we pick up most of the referrals from GPs and also A&E. And that's where those professionals have felt that the needs of someone is best suited to come in to see a crisis worker, to sort of look at the wider social factors around why someone might be feeling they're in crisis, and ways to manage that, and to focus on ways of keeping well. It's last year over 1,000 people, unique individuals, came through that service. So it's incredibly busy. We've got a brilliant team working in that service, and it's 365 days a year, so it's quite comprehensive in its reach. One of our most long-standing services is social networking, and that's in East Croydon, and that's a you have to be referred by a professional, but at the heart of the service, it's around bringing people together to have to engage in activities in a supported environment, and to at its heart, what a lot of people really value in the service is sitting down and having hot food together with people, and sharing that that experience of taking time out to sit and talk. That happens on a Saturday and a Wednesday, that food element, but the service runs 6 days a week, and it's at its heart social networking. So it's bringing people together in a supported environment. We have a counselling service. The first area of the counselling service is funded by London Borough of Croydon, and it's one-to-one counselling, free one-to-one counselling for carers, but also clinically informed groups for carers to come together and share their experiences. As I said, that's free. We welcome referrals to that. The counselling service has evening sessions to accommodate the needs of carers. We have evening sessions two nights a week. And that's spread across the services self-determined that you're a carer, so someone's able to self-refer into that. And then our counselling service is BACP accredited service. Predominantly, we have around 40 volunteer counsellors who are either registered with the are all registered with the BACP, and it's a low cost service. So it's the only one of our projects that there is a charge, compared to possibly other local mines in South London. The service is incredibly low cost, and that's funded by the main sort of part of the service is funded by the ICB, but built into that model is an element of charging. Again, this service is self-referral, and that's from what I understand, that's part of the clinical element of the service, that someone has to have wanted to take that step themselves to look for counselling rather than being referred in. Welfare benefits project. So we have a welfare benefits service that looks at benefit maximisation for people experiencing poor mental health. Predominantly, the service focuses on welfare benefit appeals and tribunal attendance. So that's generally when someone's been turned down for personal independence payment or received a reduced amount or an amount they weren't expecting, or where there's a challenge around universal credit and the amount being paid. We will attend the tribunal with someone and act as representative at the Courts and Tribunals service. Around 600 people access that, 660 people access that service last year. That's been quite consistent over a number of years. There's not many sources of specialist welfare benefits advice left in the borough. There's a handful of organisations that hold the advice quality standard, along with ourselves, which looks to basically the service is looked at to see is it's operating in parameters of good welfare benefits advice, free good welfare benefits advice. And last year the service raised more than 1.4 million in previously unclaimed benefits, and that's been consistent most years. It's normally between like 1.4 1.6 in previously unclaimed benefits. So for the money that comes in, the sort of the charitable money used to pay for that service, it really brings in a lot of money into the borough. Yeah, and we're always looking for volunteers. There's a wide range of volunteer opportunities, so that might be supporting people in active minds to go out and play tennis or badminton, or go on trips, to volunteer counsellors who are undergoing their counselling training or are already trained. But yeah, if anyone you know is interested, then please have a look on our website. And we also have a lived experience. We really value the importance of lived experience feedback in our work, and we engage people with lived experience in a number of ways. So it might be people forming part of a panel, a lived experience panel, to sort of scrutinize our work or help set our strategy, or it might be sort of ad hoc coming together to feedback on project development. And so that's another way that people are sort of able to give their time to help with the organization, and I guess ultimately make better services for everyone. Yeah, that's really whistle stop tour through. I'm aware I may have missed a few elements of some of our projects, but I didn't want to get into too much too much nuance, so that was quite a blanket overview. But if anyone had any questions, then please let me know. I'm going to stop sharing.
Thank you, Tom. Does anyone have any questions for Tom?
Can I ask one question, Kay? Sorry, just regarding the age for services, is it still 18 plus? So you don't work with under 18s?
Yeah, that's right. Predominantly, there's a slight anomaly in Active Minds that there's 17 plus because of in the work that's funded by Croydon Talking Therapies, but yes, the rest of the work is 18 plus. And sorry, I should have clarified that in the slides.
No,
we
brilliant.
know
Thank you.
There's other organisations of borough that have a really comprehensive with children and young people.
Any other questions?
See, Andrew's got his hand up.
Yeah, thank you. Thanks very much, Tom. That was really helpful. I just wonder, I don't know if I missed it, but could you say anything about Aisha's work and the community hubs that are being set up, mental health specific?
Yeah, so Aisha forms part of the recovery space service, so that crisis work, and part of our three sort of elements of our strategy. One of the sort of key aspects is taking services to people in all areas of Croydon. So
Yeah,
with Aisha's work, it's taking that crisis offer that was rooted in the Whitgift Centre and rooted at East Croydon and Fairfield House, and taking it out so that people maybe are able to find out about it at a community hub, but also at an Active Mind project when they're playing badminton or something, and Aisha's there to make that introduction and maybe understand break down that barrier, I guess, to literally putting it in someone's face that we have this offer. So yeah, but yeah, we our project to the community hubs, a number of them utilize that as a I guess a real foot into communities that we maybe a physical presence that wasn't there before. So that's been really supportive of our strategy.
may I just comment, Tom? Thanks for that. She's been wonderfully supportive of the local community partnerships program. She's just developed an amazing reputation, fantastic intuitive support across communities of Croydon. So all credit to her, and thank you.
That's amazing. Thank you. I'll definitely feed that back. That's brilliant.
Thank you.
Thank you. If there are any other questions, either pop them in the chat and we can get them to Tom, or if there's space later, we can ask. Can I introduce now from SLAM, Patricia and Lucy, who are going to share about their services.
Hiya. Hi. We've just got one slide because we thought it would be easier, and Patricia's going to talk through the kind of different areas of our service briefly, just to give you an overview, and then if we've got things you want to pick up outside, then very happy for you to do that. Are you going to share the slide, Kate, or do you want me to?
If you want to pop that up, if you've got it right there.
Yeah, I should have. Sorry, I've got.
If not, I will, but.
Yeah, there we go. Is that appearing?
Yes, we've got your notes on the side, but
Hold on. Sorry. If you go to slideshow, I'm trying to make it behave itself.
is it slideshow?
If you click on slideshow at the very top, it's getting stuck. Sorry. Is that working yet? There we go.
Yeah, there we go.
Lovely. Thank you.
Hiya. So my name's Trisha. I am the service manager for the Croydon Assessment and Liaison Service. So I'm going to run through an overview of the points here. So firstly, how can people access our services in Croydon? So our main source of referrals do come directly from GPs. So we have multiple services in the community and inpatients. And SLAM services will accept referrals from any SLAM service. So any CMHT can refer in between themselves and so forth. We will also accept transfers of cares from outside of the borough. So if somebody was previously living in an Oxley's area and they've moved to Croydon, Oxley's can initiate a transfer of care into Croydon and we will take over the patient's care. We will also take referrals from our colleagues over in social care. So for example, if we have somebody who's in supported accommodation or under a social care services and there are concerns about their mental health, our social care colleagues can refer directly into us and we will joint work with them, or where appropriate, we will kind of take over the primary lead in their care depending on what their main needs are. We will also take referrals from the RVMP in Croydon. We can take referrals from the police via Merlin reports, which usually go through our front door. So by front door, I mean we have a practitioner who is employed by SLAM but is based within social care. And so if there are concerns that come up, she can refer directly into our services. And we can also take referrals directly from the Croydon Health and Wellbeing space. All of our treatment teams, our community teams, are by referral only at the moment. But we have crisis services, site liaison based at Croydon University Hospital, and anyone can go there if they're in kind of crisis, need support, and that's without a referral. They can just go to A&E, request to see liaison psychiatry, and then from there, liaison psychiatry can direct people into the most appropriate treatment pathway, whether that be one of our treatment teams, our HTT, our home treatment team, or inpatient or psychological services. So in regards to what we offer, so we have crisis, inpatient and community based. So as I said, our crisis service at CUH, Croydon University Hospital, is completely self-referral. And we have the crisis line, which is a 24-hour free phone number. Anybody can call it, patients or carers, if they need support or advice. Our inpatients are, Croydon's inpatient base is at the Bethlehem, but we also have sites in Southwark, Lambeth and Lewisham, but where possible, we always keep people in their home boroughs, and we can offer both informal and formal admissions at the Bethlehem. We have a home treatment team, which again is referral only from mental health services. So any patient who's known to one of our services or our crisis services can refer directly into HTT. And we have multiple community bases, community teams, sorry, which are based between Jeanette Wallace House and Queen's Resource Centre. We offer a wide range of support across services. There's a lot, so I'm going to give you a snapshot of the main things. And again, if you have any questions, you can email or kind of ask at the end. So the assessment and liaison team, which is the service I manage, there are 3 services that cover north, south and central of the borough. We are a short-term service. We're essentially SLAM's front door, and we will work with patients for up to 12 weeks. During that time, we will provide medication reviews, care plans, risk assessments, crisis and support plans. And then before or by the 12 weeks, our aim is to direct patients to the right treatment pathway. So that could be back to primary care with recommendations for GP, or it could be onto our longer-term treatment services, hospital admissions, psychological therapies, or when needed, home treatment teams. We also have 3 locality teams, which are called South, Central and North, and they are also based at Jeanette Wallace House. So these are our longer term treatment teams. There's no real cut-off point for how long treatment is offered for. It's purely dependent on patients' needs. And again, like A&L, they will offer support around medication services, care plans, risk assessments, and so forth. We have a lot, like I said, we have quite a lot of services. So we have Touchstone, which is a specialist mentalization-based treatment service that's based at the Bethlehem. And that is referral only via SLAM, but I'll come back to that in a little bit. We offer crisis support via our home treatment team. We have COAST, which is an early intervention for psychosis service that's based at Queen's. We have CORE, which is a service that supports people in returning to work or employment. And they also offer kind of support with people kind of general day-to-day living. We have psychological therapies. We have IACT, which is now known as Croydon Talking Therapies, that can be accessed via self-referral, via GPs, or via any SLAM service. We have SIPs, which is our secondary care mental health psychological support services. They offer psychological therapy. This is though referral only via one of our CMHTs or our inpatients. We also offer different varieties of therapy, which is via our PD SPA referral pathway. And again, that's referrals kind of from within SLAM, so GPs can't refer into it, and it is not self-referral. We have the SUN project, which is our service user network, and that is facilitated by Touchstone. This group is self-referral. Anybody can contact Touchstone and they'll be invited along to the groups. They offer 3 to 4 groups a week, and their main focus is around crisis support. The groups are co-led with peer workers and staff. And as I said, anyone can access those. There's no restrictions on those groups. We work closely with our colleagues in social care. So if we have patients who have social care needs in addition to mental health, we, as SLAM services, do offer character assessments. We can do package of care reviews and support people in terms of finding more appropriate placements or accommodations. As I said before, we do medication reviews, care plans, risk assessments. We also offer carers support, so we can provide carers assessments. And we have a carers lead in the trust who's always available to give advice on where carers can access support. And as part of our inpatients and locality teams, where needed, we can offer OT assessments to ensure that people have access to things that they need in order to support them to get on with their day-to-day living. So we work with a variety of other organisations. So SLAM is integrated, and as I said, we work closely with our social care colleagues. And we are working on improving our relationships with our colleagues in the voluntary care sector. One of our key collaborations is with the health and wellbeing, the Croydon Health and Wellbeing space. So A&L do fund a member of staff in that centre. So we have 3 crisis recovery and support workers. They work 2 days in the health and wellbeing space, and they work 3 days with A&L. We currently have 2 in post. The 3rd one is due to start with us next month. And they offer support to patients in both the health and wellbeing space and in A&L. And as I said before, we can take referrals directly from the health and wellbeing space. So if we have people in that space who it's felt they need some more input from SLAM, our crisis recovery workers can support that transition into A&L. And likewise, when we have patients who are stepping down back into primary care, we can also support them to access the health and wellbeing space. We do work with the police, again, working on improving those relationships. So where appropriate, we share information to ensure that people are directed to the mental health pathway rather than the criminal justice system when needed. And we also, where necessary, carry out joint visits with the police as well. That was an overall snapshot. I'm aware I probably spoke quite quickly, but that is a snapshot of what we do. And obviously, in terms of developing our community mental health services, I think Lucy can speak on this a bit more, but we are in the process of moving from locality-based services to neighbourhood centres. Thanks, Patricia. Yeah, just briefly to say that across the whole of South London and Maudsley, there's a programme to continue improving our community mental health services. And that's based on like national guidance really to try and provide more integrated teams in more local geographical areas. So while we do have north, south and central teams, there's still quite a lot of different teams as Patricia was describing. And the idea is that we try and move to having those teams more joined up and working in slightly smaller neighbourhood or geographical areas of Croydon and able to link more closely with the other NHS and voluntary sector organisations in those areas. That work's only just starting, but a key part of it is strengthening our links with the voluntary sector. And one of the things that will be happening over the next couple of months is that we will be putting out a tender or a number of tenders for opportunities for voluntary sector organisations to bid for funding to work with us to provide the sorts of support that perhaps you guys already offer that would really benefit some of the people we see, but it will allow us to work together much better And some of that will be through more formal procurement, but some of it will be through a grant process as well, because we're very keen to try and fund some smaller voluntary sector organisations who are already doing amazing work in the community, and who we know, with perhaps a little bit more support from us, we could really build our relationships better. So that work is just underway now, and you'll be hearing more about that, and certainly more about the opportunities if you're interested to bid for any of the funding that's available. That's probably all I was going to say at this point, but we're happy to take any questions. Pauline.
Yeah, hi, Patricia. Thank you for your presentation. You mentioned so much sort of support, and yes, I agree, you did speak quite fast. So I just wondered, do you have in a written form like an overview of all the support that you mentioned? Where would we find all of the services that you talked about?
So on our South London Maudsley website, which it's quite a large website, we do have information on all of our services. So that if you have a particular one in mind, you know what it's called, you can pull it into our search engine, it will find it. We are currently working on a presentation. I considered bringing that presentation today, but it is extremely detailed. So there is available kind of information each service, again on our website, and I'm thinking we could put together a more brief, as we're kind of going through our transformation, we could put together some more like a directory, I suppose, of, I think Lucy and I were working on something around that. We first started mapping out our crisis services, and we completed that about 2 months ago, I think, Lucy?
Yeah, a few months ago. So there is a new Getting Help in a Crisis set of information that's available on a leaflet form and on the website, so that you can have the Getting Help in a Crisis information just for Croydon SLAM, and it does refer to a few other key resources that are available as well. So we've done that bit of it, but the bit we were also wanting to do was exactly what you were saying, Pauline, was
just
trying to summarise. So one of the things that we've started drafting is some information for families and carers, which tries to provide really high level, sort of simple description of the types of support that we offer. So we've started working on that, but we completely take your point about needing something that's a bit more streamlined and simple for our voluntary sector colleagues. So yeah, it's work that's underway, and we'd really welcome people's comments when we draft something.
All right. Super.
Hello, Lucy. You did give me the okay for a brief summary, which I was going to send out on the meeting notes to the key services, if you recall. So
yes, and that was about the crisis services, wasn't it? I think. But in terms of the other things, some of the other things, Pauline, Patricia's talked about today, we still need a way of illustrating that in a simple way, and it will change a bit as we're describing with the changes in our community teams. There will be a change as to how we talk about those more neighbourhood-based teams. But I think in the short term, we still need something that gives that overview for people.
Yeah, and I think once we do enter our neighbourhoods, it will be far less complex to understand.
Yeah, that's the idea.
So obviously, being in SLAM, we know these services at the back of our hands, but I suppose outside of it, it is quite complicated. But once we're in neighbourhoods, rather than having services here, there, and all over the place, each neighbourhood will have access to everything they need in one centre. Sarah, was your hand up?
Yes, thank you. Physical hand up. I just wanted to say, Lucy, I know you are working with the Croydon Mental Health Alliance, and I just wanted to remind everyone that there is in Croydon a voluntary sector Croydon Mental Health Alliance for mental health and wellbeing providers, and it's kind of co-led by CDA and Minding Croydon, hosted by Minding Croydon. So if you want to join, I'll pop my email in the chat. And that's a good space to, kind of share information with other providers, but also meet SLAM, meet the council as well occasionally, and work in partnership, really.
Yeah, and I think Kevin might be on the call, and because I can't see everyone who's on here, but Kevin, I've just seen that your name's up here. I don't know if you wanted to add anything about the work that you're doing and the community service development programme, or anything else about the health and wellbeing space. Because can see his name, but I'm not sure if he's...
Yeah, he's here.
He is here, isn't he?
He is, yeah.
Right. He might not be free, he might be caught up with something. Just to say, Kevin's on the call. He's one of the clinical psychologists, the clinical psychologist lead in the health and wellbeing space, and he's also one of the leads for our community service development program. And that program is being run jointly with some of our community representatives from Croydon BME Forum and with some service user and carer reps. So it's very much going to be jointly run together with some of those partners to help us make sure that we keep grounded and stay relevant to what people in Croydon need. But I don't think Kevin's free to speak, sorry. But just so you know who he is, I just thought it'd be helpful to say.
Are there any other questions?
I guess the most important thing, Patricia, is that if people are concerned about somebody, then the crisis line and A&E still our two main routes into support in an emergency situation, and the health and wellbeing space is a key route in terms of that service that Tom was also talking about just now. And talking therapies, Croydon talking therapies can be self-referral. Anyone can refer to that, but otherwise people need to go to their GP and ask to be supported through to the mental health teams. I guess, Patricia, that's the...
Yeah, and again, if you access talking therapies or via our crisis services, they can refer directly into our treatment teams, and we do aim to see patients quite quickly. Andrew, you got your hand up?
Yeah, thanks. Thank you very much, Patricia. Thank you, Lucy. Just building on, I suppose, what Sarah's just made people aware of, really, the Mental Health Alliance. Just to mention again, the local community partnerships program, really, because that's an opportunity to connect with a very wide range of wonderful voluntary community and faith sector organisations who are doing amazing preventative work, really. That program obviously been going since 2020, so well established, and at every event there's the opportunity to connect and find out about the preventative work that those organisations are doing, really. So it's just always a good way into connecting, forming partnerships and finding out what's available in each of the 6 localities, but also what they're working on, really, in terms of some of the local community plans, really. For example, I know in the Southwest that the mental health is a key theme in the Southwest local community partnership, really. So yeah, that program of events, which again, all the events are on Croydon Voluntary Action website, really. Got resource fairs coming up in the next few weeks. So yeah, just a great opportunity.
One thing I'll add is that I'm always happy to kind of take questions. So if anyone has any questions about how to access our services, as the manager for the front door, I quite often get those emails, and I'm happy to kind of advise and direct where I can if anyone's got any questions.
I was going to say, Patricia, do you want to put your email in the chat as well, just so people...
Yep, I will do that. I think, yeah, no, I haven't done that yet.
Sorry, there is the Pioneers group wanting to ask a question. I think they're back. They kind of pop out. Maybe the internet wasn't good, but then they were back. Are you in the room?
Mm-hmm.
Oh, please ask your question. Thank you.
Hiya. My day job, I work in the district nursing service, and so we do have some older adults with mental health issues, and we find it very difficult to find who is looking after them in the community. And when we call SLAM, we get directed to all different telephone numbers, and it's a real slog if it's not in their GP notes or on their on the sites that we can access to find out who they're under. Is there a direct way of finding out who actually their care coordinator is directly from SLAM?
Yep. So people, again, often come to me. I can kind of do that check. Obviously, we're restricted in what we can share in terms of without having to know who works where and patient consent. But if it's simply a question of who's the patient's team care coordinator, I can always direct people to the right care. And also people often go via, so our ARC is our bed management service, but they often do find themselves questions, and likewise the crisis services are always able to direct people to the right care teams where there are concerns about someone's well-being or mental state.
Okay, thank you.
If you want to connect with us around that, because our older adult services are slightly separate from the 18 to 65 services, and then we have our children and adolescent mental health services, which are for the younger people. So there are different teams depending on how old somebody is, and once you get to 65 plus, it's the older adult services that you need. But it might be that we could help you particularly know who's the right people to talk to in those services. If you wanted to pop your email in the chat or get in touch with me or Patricia, we can help you with that.
I will do. Thank you very much.
Okay, if there are any more questions, then do feel free to pop them in the chat and we will get them to Lucy and Patricia. Just a quick reminder, if you haven't already done so and you missed the message at the beginning of this session, can you introduce yourself in the chat and provide your name, organisation and contact details? That will help us to register you and to make sure you get the meeting notes and the recording, etc. after the session. Thanks for that. So now we're able to hear from quite a number of our local organisations that are providing mental health support in Croydon. We've allocated 3 minutes per group for a quick fire information. We will do a summary of what's being said and then just a little bit of time to answer questions if there are any relating to the individual services. So if we can start off with Manju from MS Foundation for Mental Health. Are you there, Manju?
Yes. Good
Great.
morning, everyone. So thank you so much for giving me this opportunity to speak. And as I have been introduced, Manju Shahul Hamid. I have a presentation as well. Are you going to play the presentation or do you want me to share the screen? How does it work?
If you could share your screen, that would be great, Manju.
Oh, okay. Thank you. Can everyone see the screen?
Yes, we've got your notes on the side, so if you'd like to put it on slideshow.
Can you all still see it?
No.
Can you see the screen?
Yes, we can see it. Thank you.
Brilliant. So yeah, good morning, everyone. So Manju Shahul Hamid. I just wanted to talk about some of the services we provide through the charity. So I myself and a number of volunteers, we run a charity called Manju Shahul Hamid Foundation for Mental Health. So we are based in Croydon. It's a registered charity. We just wanted to give you some background about the charity. We founded 8 years ago in Croydon, and the mission of the charity is challenging stigma and also providing inclusive mental health support in the community. And we provide free mental health support for all our events. We provide free service. And the focus is on Black and Asian minority ethnic communities, especially because of the stigma in those communities. We wanted to make sure that we provide that free service, and we have a website, and website address is on the screen. So one of the programs we organize in the community is Dementia Cafe. So we have we started the Intergenerational Dementia Cafe project in 2022 with the support of Age UK Croydon. So Age UK Croydon is one of the partners in that project, and now we have 4 dementia cafes across Croydon. And the reason for the dementia cafe is to provide the support for people living with dementia and their carers. And it's all about bringing the communities, and it's an informal service where people with dementia, their carers, and the community can come together and be part of that space. So in terms of the areas we cover, so we have the first cafe that we started is at Coulston Methodist Church, and the partners are Age UK Croydon, and we also work with John Ruskin College to bring in that intergenerational element. So the students of the young people of the college come to that cafe and provide that service. And the second dementia cafe is Clock Tower Cafe next to the library, Central Library. And we are working very closely with Croydon Council's youth offending team. And so they bring in young people from the council and the care leavers to that cafe to bring in that intergenerational element. So young people who come there volunteer at that space. The third cafe is at Croydon University Hospital. So one of the feedback from the people who attend the Dementia Cafe at Coulston and Clock Tower Cafe was to get that clinical expertise at the cafe space, because they wanted to get to know about sleep hygiene, get to know about fall prevention, and a number of areas they wanted to get some information and advice. So that's one of the reasons we decided to start the third cafe at Croydon University Hospital. And so there, what we usually have is we have a clinician who come and provide advice, information, and we do have a Q&A session towards the end of the presentation to bring in that element from the clinician side. So from this month onwards, we also bringing in a primary school will be involved, and we are bringing in the young people from the students of the primary school, and they'll be coming in to do some reading and singing along and those kind of activities. The fourth cafe we started at Coulston Temple. So we only started it this month, and there we will be bringing in some dance workshop, music workshop, and also bringing in that cultural element to that cafe. And we also have yoga sessions there at Coulston Temple. So those are the 4 cafes that we operate. And in terms of the dates, the first cafe is first Tuesday of every month from 1:30 to 3:30. The second one is on the third Monday of every month at Clock Tower Cafe. Croydon University Hospital is the last Monday of every month. And the Coulston Temple is the second Friday of every month. So we just wanted to make sure that we cover every week. But then that information is also updated by Kay in the CVS website. In addition to that, we got some funding from Maudsley Charity for living well with psychosis. So the funding was already approved a couple of months ago. And what we are doing is we're providing some individual counseling surveys, and we will also providing the psychosis support through our 4 dementia cafes. And another session that we organize at West Croydon Methodist Church, the session is called Coffee with Counselor. So there we started off with, one of the reasons we started that session is to provide food to the homeless people, but then some of those people who come to that food bank, they requested whether we could provide some mental health support, because some of those people, the homeless people, the refugees and asylum seekers who come to West Croydon Methodist just to collect the food, they have, a number of them have mental health issues. They requested us whether we could provide that support. So we brought in a counsellor to provide that support. But then when we started having that service, we have been requested whether we could bring in some housing, employment, and also bereavement support. So what we're working with Evolve Housing on housing provision, Croydon Works on employability support, and also ESL has CALAT has starts from last month started providing that ESL support. And also we have Roland Brothers who come and provide the bereavement advice and support as well. So we are becoming like a hub, providing all this support at the Coffee with Counsellor session at West Croydon Methodist Church. And in addition to that, we have, annually we organize Silver Sunday. This is an annual day for older people, first Sunday of October. So the next event is on the 5th of October at Clock Tower Cafe. We also do an annual intergenerational care event during Black History Month. Again, that falls on next month in October. So on the 14th of October, we'll be taking some elders to John Ruskin College, and the young people from the college will be providing some pampering sessions, the manicure, pedicure, beauty therapy, and also some, photo shooting and those kind of sessions. So it's like, it is from 10 o'clock to 2:30. And we have been running that session for the past 5 years, and it's always get fully booked. Very similar to the Silver Sunday events. And so those are the 2 additional events we organize. We also provide the counseling service for young people and also adults. We provide throughout the year, and depending on the request we received and depending on the funding that's available, we provide that service. We work very closely with a couple of counsellors from the community. And in addition to that, we do offer first aid training, adult and youth first aid training, and also suicide first aid training as well in the community. I just wanted to leave you with some contact details for the charity. If anyone would like to get in touch with us, please let us know. I'm happy to happy to answer any questions or discuss any of the events that we are organizing in the community. Thank you.
Okay, thank you, Manju. Are there any questions for Manju? If there's not, again, pop it in the chat if you think of anything. As we've got quite a few people to sharing this this morning, can I introduce Kelvin Ahmad, who is going to share about Croydon BME Forum.
Hello, good morning. Do I need to share my slide, or can you do it at your end?
If you can do it, that would be great. Thank you.
Let's see if I can. Can you see that?
Yes, brilliant.
I don't know how much of it you can see.
We're seeing half the page at the
Only
moment.
doing half the page. Okay. What to do full page? Sorry, I can't get to close this. Okay. All right. Is that better? Can you see it
We
now?
can see it.
Let's just see. Okay. My colleague's just trying to help me to change the view. What can you see now? Can you see all the slide?
Not all of the side, but the majority in the middle, we've got the spokes and the descriptions.
That's all there should be. It's just the. Somebody just give me a bit of support here. That better?
That's it.
Okay,
Brilliant.
cool. Sorry about that. Yeah, hello, good morning. My name is Kelvin Omard, and I know I've got 3 minutes, so I am going to do a whirlwind tour of the Croydon BME Forum. Quick background, it's a community organisation charity that has been established within Croydon for over 20 years. Initially, its focus was capacity building, working with small charities and CICs to help them develop and become incorporated either as charities or as small companies. Over the years and since COVID, there has been a lot of focus of our work on health inequalities in the London Borough of Croydon. So we run our services out of 3 buildings here at head office in Mitcham Road. We also have a centre in the Whitgift Centre, which is our wellness centre, and we also work in partnership with the Croydon Wellbeing Space. So as you can see on your screen, we have a range of support services that we provide. So the first at the top in the red circle, we have our independent advisory group. And this is a project spearheaded by our wonderful colleague, Tanya Rose, and it's to striving to improve access and the experience of and outcomes for Black service users and carers in mental health services. And that is done via training events, community events, and we work in partnership with Lewisham and Wandsworth as well. Our next wheel is the community development team or workers. We have 2 working at a young end, 25 to 65, and we also have 65 plus. And the community development workers, their main focus is well-being, and we provide that well-being via coffee mornings, games hours, readers groups, compassionate chats, and we also have an online Young at Hearts group. Next to that, we have in our purple circle, we have access to social care, and that is spearheaded by my colleague Savetha, and it's literally what it says. It's to improve access to social care. So that's access to a needs or a care assessment. We also have our Windrush compensation scheme. The Windrush compensation scheme is to support members of the community to apply for compensation under the Windrush Advocacy Support Scheme. And that's provided by my colleague John B from our Wellness Centre in the Whitgift. We also have our MHIP project, and the Ethnicity and Mental Health Improvement Programme is a community-led intervention programme to reduce ethnic inequalities in access, experience and outcomes for mental health care. And this is provided from a series of hubs in and around the borough, from the Wellness Centre, from Thornton Heath. We deliver this service in partnership with ARCC, and it's really via to raise wellbeing via a series of workshops and other support interventions. So you can get one-to-one support, there can be group support, and we also have a free counselling service called Rooted in Care. Our next wheel, we have our long-term conditions, spearheaded by my colleague Desta, and this is a service that essentially looks at those very specific long-term conditions that can affect the Black and Brown community. mainly hypertension, diabetes, and stroke. Via the health checks that Vesta provides at the Wellness Centre or around the borough. Someone can come in and they can get a health check, they can have their blood pressure taken, they can also have a diabetes risk assessment. And then if need be, they can be referred on to a GP or, the health services. One of the things that we'll be doing soon, we'll be rolling out a vaccination program for the winter that will be COVID and flu vaccinations. We also have our EDI and maternity project, spearheaded by my colleague Jessica. EDI standing for Equality, Diversity and Inclusion, and the maternity project are both research projects looking at the experience of the Black and Brown community in primary health care. Our maternity project has started to take on, not from a clinical perspective, but from a support perspective, women who are beginning their journey in pregnancy, and it's really to give them one-to-one hand-holding support. We also have an asylum seeker program. We're actually just about to graduate our 6th cohort of asylum seeker workshops. Our asylum seeker workshops are provided every week. They're in 2 parts. Mental health is the first hour. The second hour is integration. And at the end of the 4 weeks, there's a graduation where they get a certificate and a goodie bag. And it's really a wonderful place for the asylum seeker and dispersed people community to come once a week, meet with each other, meet with us, get some information about how to better integrate into the community. And finally, but no means least, we have our Can You See Me project. Our Can You See Me project is delivered in partnership with Macmillan, and we provide this cancer support service across 6 boroughs, which is Croydon, Kingston, Merton, Richmond, Sutton, and Wandsworth. And we do community outreach through the Can You See Me projects, focus groups and conferences. We should have a conference coming up again in January. We upskill healthcare professionals. We also do a lot of collaboration with local organizations around cancer treatment and cancer awareness, and we do one-to-one support. I'm sure that was just over 3 minutes, but that's me done. Any questions? If you do want, I don't have a slide like my previous wonderful colleague, but if you do want to find out any further information about any of our services, you can call the Wellness Centre. You've got a pen on 0208 680 3635. That's 0208 680 3635. I've also put my email address in the chat and you can email me directly. Thank you.
Excellent. Thank you very much for that, Calvin. Full of information. And I will be putting out the contact details in the meeting notes afterwards. But as you will see, they're obviously in the chat too. Right, if we can move on to the next person on our list. We have Helen Harris from Purley Baptist Church, who's going to share about the Renew 23 Cafe. Are you there, Helen?
Helen is muted.
Okay, maybe we'll move on and come back to Helen. We've got Asian Resource Centre, Croydon. Naeem is going to share about the Unfolding Layers project. Thank you, Naeem.
Hi, thank you. Sorry, I don't really have a presentation today, but I do have the flyer for the Unfolding Layers. If it's okay for me to share that?
Absolutely, thank you.
Brilliant. Sorry, just 1 second. Yeah, I'm not sure even if I can share that. Looks like some technical issue. Okay, I can share this one. All right, I'll share the website page and just talk through it quickly. So the unfolding layer is a mental health project we run. So small projects. So we have the individual counseling and we also have a group therapy. So today, I'm just going to talk about the group therapy. This is the second cohort we are hosting at Asian Resource Centre. So the session started, so this cohort actually started on the 16th of September. So we had the first sessions this week. We had the second session, which was 23rd yesterday. To about 4 people on the first one and the second one as well. We've got 4 more sessions left for this cohort. And it is on relationship challenges with parents, partners, sibling, or offspring. So that's the theme for it. Anyone can join that. So through our website, you can contact us, give us a ring on 020 8684 3784. It's also available, all these resources are also available on our website as well. So I'm not going to go into much into all the other projects we run, but if anyone is interested, if you want to signpost and want to know what else we do, you can always go to our website and click on the project page, which has all the project listed on there. And then the mental health one, there's a contact detail, so you can also email or refer clients. You can just send us an email with the details and we can contact them. We also have a built-in form on the website, so if anybody wants to self-refer, they can do that by completing this form. It takes about, I'll say, a good 15 minutes to complete it. It does ask about quite a lot of details, but it is needed for the counselling. So that's pretty much it. Unfortunately, I can't really share the flyer for the group therapy for some reason. It's not, but I'll drop it in the chat and I can also email it over for everyone else to have access to. Anyone that has any questions?
Thank you, Naim. If you do email that flyer to me, I can add that to the notes.
Brilliant, thank you.
Thank you. Is Helen there now?
Yes.
From
Yes.
Hello,
Helen.
Helen.
Sorry about that.
Sorry.
That's all right. No. As you can see, I'm not very technical, so I'd probably use all my 3 minutes in trying to upload something. So I'm just going to chat if that's okay.
Brilliant.
Renew Wellbeing Cafe, known as Renew 23. We meet every Thursday from 10 till 2. And I say every Thursday because we are virtually open 365 days, Thursdays a year, because we feel that people who are vulnerable or on the mental health spectrum feel lonelier during school holidays when they think everyone's with their families. And we've even opened for 2 Boxing Days just for a couple of hours, and we've had about 10 people come. All the volunteers are Christians, but that doesn't mean that only Christians can come to the cafe. We welcome everybody. We have people who say they have no faith. We have people from different faiths, and they feel very comfortable with us. And it's a safe place where it's okay not to be okay. It was started by a Baptist minister, Ruth Rice, who had a severe mental health breakdown. And because she was a Christian, she felt called to set up places where it was okay not to be okay. So what do? We do games, we run craft sessions, colouring, and we encourage our guests to bring along their own craft. And one of our ladies has taught umpteen people how to knit. And then they work on a project that, like a blanket, which they can give to maybe a baby unit or something like that. They feel they're being really useful. We provide lunches for them, so they have a sandwich lunch, fruit and a homemade cake every week. And we do charge £1 now, if people can afford that, just to help with the craft expenses. It's run around 3 principles, so that's being present, being prayerful, and being in partnership. So being present is easy, we just turn up. Being prayerful, we do have a 20-minute prayer slot at lunchtime. No one is forced to come to that. We just say if people want to come into that space, they can. And we usually get about 30 people that come to the cafe, and at least 20 come in. And that is people who say they're atheists or who have other faith just because they enjoy that space and quiet. And being in partnership, we have a lovely man from Rowland Brothers come and run his bereavement counselling sessions from our cafe. And we also have a lovely lady at Purley Job Centre Plus who comes over, and what she doesn't know about helping people with mental health problems, you could write on a postage stamp. She's a lovely lady. So just to say that we have all sorts of people coming into our cafe, and some of them may just come in and sit and cry maybe for a couple of hours, and we just let them do that. We don't bombard them with questions. If they want to talk to us, they can. It's totally free, whatever they want to do. But on the other end of the spectrum, we had a lovely lady who came in like that, but she says by her own admission that through us just welcoming as she was, not asking questions, showing unconditional love and support to her, she was able to do a nursing degree, and she now nurses in Croydon University Hospital. So that's our delight, really, that that we help people to move on in their lives. And we also try and protect our own well-being. So you will see us sitting down doing a jigsaw and chatting, or doing some colouring, just so that we take some space out as well. There are 4 other cafes in our local area who we network with to support each other. And there's about 150 cafes over this country, and it's also abroad. So it's a lot of our guests say that we're the family that they never had. So I think that maybe 4 minutes, sorry.
Thank you very much. I'm sorry to rush into the next. We've got 8 groups still would like to share. So again, pop your details, any questions in the chat, and I will forward them. We next have Dr. Bala Parvatham from Change Grow Live. If you can just be mindful of the time, please,
Sure.
just because we are
Sure.
and everyone wants a chance
Sure.
to speak. Thanks.
Thank you so much for having me here. I'm Dr. Bala. I'm the project lead for Smoke-Free Croydon at Change Grow Live, and I don't have any presentation or slide as such. I'll just be vocal and be mindful of the time. Let me explain more brief about our service. We are a specialist service commissioned to support people quitting smoking or reducing smoking, particularly people suffering from severe mental illness or experiencing homelessness or experiencing drug and alcohol abuse. So it's a free service commissioned by Croydon Council. We are based at Lantern Hall at Change Grow Live. And we do offer support for the people lasting up to 26 weeks. We have different treatment pathways for the people helping quitting smoking or reducing smoking, as smoking is one of the preventable causes of death. I think I'm done. Any more questions? I'll just drop details of our service.
Thank you very much for that. I have got your notes that you passed on to me, so I will add those in the meeting notes for contact details, etc. Okay, next on the list is Amanda from Good Food Matters about the men's shed.
Oh, hi. Hi there. Can you hear me?
We can, thank you.
Right. Just slide. Is that coming up?
Not yet.
Can you hear and see me?
I can hear you.
Okay, well that's a start. I have got some slides, but I'm not sure whether they're playing yet. So I'll just start off, and then hopefully this will catch up. And I'll share the slides anyway with you for afterwards. So Good Food Matters, we're a charity that have been around for 20 years, and our aim is to help grow a healthier community. My focus today is talking about the services that we offer that support mental health and well-being. But we do offer quite a broad spectrum of services. So we have a men's cooking club, we have an elders cooking group, and we run some youth services and some support services for refugees and displaced people. What I'm going to focus on today is our Men's Shed programme, which is funded through South London Mental Health Services, and it's focused at men who are 18 plus, who are socially isolated and potentially more likely to be at risk of suicide. So we've been running the Men's Shed for 5 years. It was the first Men's Shed in Croydon. Pleased to say there's a few more now. So there's another Men's Shed that is at Monks Hill, and there's another one in Biggin Hill, and we're also part of the UK Men's Shed Association. We run on a Friday from 11 till 3, and we do work on the land, and we also do some woodworking activities. We come together with our other community volunteers and share a meal. We do lots of signposting and wraparound support to other provisions. And if anybody's interested, hopefully you can see the flyer, but that will be shared. It's very easy. There's no cost. There's no, hopefully no barriers to attending. And really we're focused on people who are isolated and lonely, who might be at risk of suicide because of low-level mental health conditions, perhaps need respite from caring responsibilities. And we do quite a lot of intergenerational work across the established group, and also focus on well-being and, you know, healthy balanced diet, how to feed themselves on a budget, and refer people onto some of our other services. So I think that was 3 minutes. If anybody's interested, my contact details are in the chat, and Kay, if I can send you the slide and the flyer, you can share it with everybody afterwards.
Super. Thank you very much for that, Amanda. Thank you. Right. Next we have David Ashton from Hear Us. Are you there, David?
Yes, I'm here.
Thank you.
Hello, everyone. Good morning. I don't have a presentation or anything, but I can share my screen just for our website, if that's okay. If I can remember how to share in Zoom. There we go. So I am David from Hear Us, which is a DDPO in Croydon, a disabled people's organisation. We are Croydon's mental health service user group. We have a number of different sort of services and projects that we run in Croydon. So I myself manage our welfare rights advice project, where we help people sort of from with a wide range of benefit issues and a wide range of benefits, any and all kind of benefit matters. So PIP, universal credit, employment support allowance, you know, housing benefit, child DLA. We've done it all really. We can help with initial claims, doing sort of work capability forms, PIP forms, review forms, challenging decisions through mandatory reconsideration, and also sort of representing at social security tribunals appeals. You know, from start to finish, we do our best to kind of help people to get what they're entitled to and maximize their income. You can access that service. We do have a referral form on our website. I think it's currently showing as closed right now. I just checked, but it should be open by the end of the day. Occasionally we close if we are at capacity. It is an AQS accredited service, and you can also people can also call us, email, and we'd be happy to accept referrals from people directly or from people, professionals supporting an individual. You just have to be a resident of Croydon and have mental health difficulties. You don't need to be under services. You just need to be in Croydon have mental health difficulties. We also have a campaigns project, which includes our reach out challenge, where we try and challenge the stigma of mental illness and share what it's like to live with mental health difficulties. So I think that's always looking for volunteers and for people to sort of get involved to share their experience. As part of that, we are running Reach Out Create, where we are having sort of artistic and creative sort of days and workshops to help kind of bring people together and through sort of a creative medium, help to challenge the stigma of kind of mental health difficulties. So that's really open to anyone who's kind of interested in sort of artistic expression. And oh dear, let me see if that works a different way. Yes, so we partnered with Liz Atkins, so who I'm aware is a friend of the Bethlehem Gallery, and you can see sort of some of the workshops, some in person, some online, that people can get involved with through there. So we'll have the open forum, which is the first Tuesday of every month, online, where we invite guest speakers to talk about topics of interest. So I think that's sort of whistle stop tour of Hear Us. So if anyone have any questions, I'm happy to answer them. But otherwise, I think that's me done.
Thank you, David. If you or anybody else who's shared today would like to share any flyers or links, send them to me and we'll make sure everybody gets them. Next on the list, we have Sally Davis from Studio Upstairs. There, Sally.
Hello, hi. Hello, I've shared my screen. Is it working? No.
Don't have anything.
You don't have anything come up?
No.
Ah, okay. Well, I can work without it if that's. Why is that not working? Okay, I'll just have to. I'll do it without the visuals.
Thank you.
So my name's Sally Davies. I'm the administrator for Studio Upstairs in Croydon. And I'm really pleased to have the opportunity to share our service with you. We're a charity whose aim is to provide nurturing art studio settings where everyone can express their creativity, connect and thrive within a supportive art-based community. So the charity was set up in the 1980s by a group of art therapists who were interested in alternative models for care and rehabilitation for people with mental health and emotional difficulties. That group evolved and became more professionalised and became a registered charity in the 90s. And we expanded to our current locations in Dalston, Croydon and Bristol, which brings us up to today. In terms of our current activities, alongside our established studios, we've also started running a weekly group in Mitcham. So that takes place on a regular basis, alongside our services in North and South London. We also aim to hold regular exhibitions of our studio members' artwork to showcase their creative journeys, and when funding opportunities allow, we also run short projects and workshops in partnership with other organisations, such as a specialised group for carers or online sessions. And we also deliver workplace wellbeing workshops for companies and organisations. In terms of our Croydon studio, we've been based at the CVA Resource Centre since 2024, which means that we have great transport links and we also have greater accessibility. While we're called Studio Upstairs, we're actually on the ground floor with step-free access, and we also have access to accessible toilet facilities, which has been a real game changer for us. We have a kind of unique working model, which is that we provide a nurturing space that everyone can use as they wish for their own art making, with support from studio managers. Our studio managers are both qualified and experienced art therapists, but also practicing artists, so that they can provide practical support with art making, but also emotional support to help people engage with and socialise with the group. There's kind of three aspects to the studio model. All of our studio members are supported to work as individuals to use the space as they would like at their own pace. This enables personal development, which is supported by our studio managers, and also by the social interactions that take place within the studio between our members. We focus on improving well-being and people's personal growth and development. So the studio works to nurture each member's art practice, which can become a vehicle for personal growth and a process which facilitates the learning of new skills, self-expression, and the development or rebuilding of one's identity as a creative person or in relation to the studio group. And the whole setting is supported by the studio manager role, so that it's not a traditional art therapy setting. We don't analyse the content of the artwork that people are making, but it's not either a traditional art class where people are being led through a particular activity. And the studio managers work alongside the other studio members, making their own work and modelling the creative process and the challenges that might arise during those processes. At the same time, the studio manager is also there managing the group, helping people to navigate conversations, and helping people to develop their own particular projects. In terms of our studio space, we have all of our art materials and resources available on open shelving, so people can explore lots of different materials whilst they're in the studio. They could use watercolour or acrylics or clay. And people also have their own dedicated working space. So everyone has their own desk to work at, and they can use an easel if they'd like to. And also we have a very flexible attendance model. So our studio members can arrive and leave whenever they choose during our opening hours, which are currently 10:30 till 4 o'clock. And we also have a small kitchen available so that people can make teas and coffees, and also store a packed lunch if they'd like to. Whenever opportunities arise, we exhibit our artwork, and we're really looking forward to holding an exhibition at Turf Projects in December, and we'll be sharing information about that on our Instagram page and also our newsletter when we have the details. In terms of joining the studio, if somebody would like to join the studio, there is a membership fee, but most of our members use adult social care funding or a personal health budget to pay to attend the studio. Once a referral's been made and funding's agreed, we offer our potential members an initial visit so that they can come and visit the studio and see what it's like and meet our studio manager. And this is followed by a free taster day so that somebody can have the experience of spending a day in the studio before they decide to commit to attend regularly. And once somebody does join the studio, we take them through a goal setting, an assessment exercise, and help them plan out how they'd like to use their time in the studio. There are certain situations where we can't offer somebody a place, which are all listed on our website on our referral page. But we would always discuss with somebody and with their support team before we decide whether we're able to support somebody fully and offer them a place. If you would like to contact us, our website is studioupstairs.org.uk, and I will share our details in the chat.
Thank you, Sally. That's
Thank
excellent. Next we have Jocelyn. Are you there, Jocelyn, from Divine Recovery? Right. The next on the list is, I'm not sure if I'm going to pronounce this right. Is it Markella? Sorry, you're on mute.
It's Marcella.
Marcella. Thank you.
Yeah, hello everyone. I'm Marcella. I'm from the Avanti Mental Wellbeing CIC. I see if I can get my presentation up. Can you see it? Can you see the presentation?
Yes, that's fine. Thank you very much.
Okay, brilliant. Let me see, how can I'm just... So basically, we are an organization based in Mitcham, based in Merton, and we offer a variety of services for people with diagnosed or undiagnosed mental health issues. Just I can't really see how I can move So we offer a variety of services. Some are directed at other organizations. So, for example, we have a supervision service, and we offer reflective groups, and also mental health and well-being training for other organizations. We work also together with, for example, with Merton Council. Sometimes they do. We offer to facilitate focus groups and things like that. Our main project is called Avanti Connect. It is funded by the National Lottery, and what it entails is we offer groups, weekly groups, an art group and a music group, whereby we think that art offers has a lot of positive impact on people with mental health problems. It is not only creating the art, but also interacting, meeting, and making new friends, and creating a social network. And so, I mean, we are in Merton already for 8 years, and there are some people in our groups who are there already for a longer period of time, or sometimes they've in between they've been in hospitals, or and Avanti offers them. It's their social network, it's their place always to where they are able to get back to. The thing is that our Avanti Connect project is not only available for people in Merton, but it is cross boroughs. So it is accessible for people also in neighbouring boroughs such as Sutton, Croydon, and Wandsworth, and so on. So here are a few pictures. We work closely with an art therapist. We have done a few exhibitions, and we are just planning another one, an immersive exhibition. The service is free of charge. And in addition to the weekly music and art sessions, we also offer one-to-one support sessions if that is requested, if people need that bit of additional support. We offer also a carers group. We've been funded to do a carers group. The carers group is mainly for Merton carers, but also for carers of who live in the residence of neighboring boroughs. So we can also accommodate those carers. Yes. Yeah, our main focus is to improve mental health in the community via offering a platform for people to experience new ways of communicating and of expressing themselves, and it gives people a really sense of achievement. For example, to be able to do exhibitions and things like that, or to be on stage, and also to go a bit outside of their comfort zone. Yes, yeah, my background is in mental health. I'm a psychotherapist and I'm a life coach. And I can only say that we get so much positive feedback by using this approach. We received the big South London Innovation Award in 2023 for our work, and and after all these years, I'm still excited to work in this field. I think that's it from me. So if there are questions. Just try. How can I?
Thank you very much. I notice we've got just under 15 minutes left. We're doing well. We have at least 2, if not 3 people to share. So if we could, Brenda, are you there from Rethink Croydon?
Yes, I am. Can you hear me?
How can
Yes, we can hear you.
Oh, good. Okay, I'm Brenda, and I attend the Rethink Carers Support Group, which is registered by Rethink nationally, but we are independent. Rethink nationally was originally the National Schizophrenia Fellowship, but now includes many different mental health issues. So Rethink Croydon was formed by carers over 50 years ago and have been in many different venues in that time. We're totally self-funded. We've all had personal experience of caring for someone close to us and understand what it can be like supporting someone through challenging times and challenging treatment, both short and long term. So we have within the group, there's a lot of experience to be shared. We meet on the 3rd Wednesday of every month. There is a rule that what is said in the room stays in the room, so that carers can share openly and know that they will not be judged and information kept private. We've had, last couple of years, we've been able to invite various speakers and have had some very interesting sessions, because many carers find that it's very difficult to find the right information, where to go for help and how to help one's loved ones. Despite, obviously, from what I've heard today, there's a lot of information available, but I think hearing it from other people who've been through similar experiences can be very helpful and useful. So this year we've had sessions from people from housing, the police, access social care, and a council rep talking about appointancy ships, and a director of Croydon Mental Health came last year and will be coming again at the end of this year, because we're not campaigners as such, but we try to make an impact if we can on local decision making. We meet in the venue currently is in a church near East Croydon. We rent a room there, but we've we would ask if people would go on the National Resync website to find us and to find the name of the current person to contact for further information, so that when they come, we can tell them how to access the room and that we know they are coming. That's it.
Thank you, Brenda. Next we have Lucas from Care to Listen. Are you there, Lucas? Okay, and the other thing I noticed, there was a message from Bianca Hutton-Wood, who wanted to share about their wellbeing project. Are you there, Bianca? No?
I'm here.
Oh, hello, Bianca. Is that right? You wanted to share a little bit about your project?
Yes, if possible, please.
Yeah, if you could just keep it brief. It's
of course
10 minutes. That would be great.
Okay, awesome.
Sorry, that's 10 minutes to the end of the meeting.
Yes, no, I understand. 2 minutes basically. Yeah, that's
excellent.
fine. My name's Bianca. I'm a founder of a company called Inspire New Creative Performing Arts. Been running for over 10 years in Croydon, Southwark, and other local places in London. And we've recently been endorsed by Croydon Council to run a project, a wellbeing project for men, specifically from global majority, that are experiencing low mood, low confidence, gone through a hard time, loss, and where you're basically using drama as an art form to help them to creating a safe space and helping them to express themselves, to kind of get out of those dark places, if that makes sense. And it's all about giving men a safe space, like I said, a space to talk, a brotherhood, forming a brotherhood. We've started about 2 weeks ago, and it's going from strength to strength already, which is really good. But we just want to get the word out there. If there's anyone else that is in need of something like this, to come and join our group. It's completely free to join. It runs every Thursday at West Thornton Primary School at the Rose Court site at 7 p.m. And yeah, we're just open for more men to come and join and to be to join the brotherhood, basically. Also, we've got a pastoral team, a wellbeing coach. There's different people in place, but it'd be good also to communicate with some of the people online today, how we can get that support, the clinical support. But yeah, I've put my email and our website in the chat, so that's how you can contact us. So it's www.incpa.org.uk, and email is b.hutton, HUTTON -wood @incpa.org.uk. Thank you so much.
Thank you.